Thank you, Madam Speaker. During our discussions in health estimates, I asked the Minister of Health and Wellness, are there any planned closures, reduction in hours to emergency room services in Nova Scotia in the coming year? The answer was no. Yet days later, we learned the ER at Queen's Hospital will no longer be open on weekends. I asked the Minister again, are there any plans to close or reduce ERs or change emergency rooms into urgent care centres in the coming fiscal year in Nova Scotia?
I recognize the Honourable Minister of Health and Wellness.
So certainly we continue to work with physicians across this province who are working in our emergency departments, and we don't plan closures. We sometimes have unplanned closures, however, when circumstances arise. Sometimes they're longer term, sometimes it's a waiting room full of people, the physician gets a headache and has to leave. We have to work with what's in front of us. And so we are working across this province to understand how we best utilize the resources that we have in our physician group. We work with them when they identify that they need a different model of care. We do that, but that's not to say that we are looking at dropping any level of service for the long term. This is interim. We continue to work with physicians across this province, and we will continue to provide care to Nova Scotians to the best of their ability.
I recognize the Honourable Member for Halifax-Armdale.
Thank you, Madam Speaker. Nova Scotia Health is hosting a community meeting on Wednesday, March 25th in West Hants to discuss, I quote, important updates on our healthcare services at Hants Community Hospital and in the community. People have contacted me with the belief and concerns. This meeting is to discuss or announce changes in the emergency room services at the Hants Community Hospital. I asked the Minister, are there plans to close, reduce hours, or change the status of the ER at Hants Community Hospital?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. So I will say that throughout the province, the zone leadership with Nova Scotia Health is working very, very hard to meet the needs. We've done a number of things. We have recruited a number of emergency room physicians. We've extended capacity by having physician assistants in the emergency room. We've extended capacity by having nurse practitioners in the waiting room. We have waiting room care providers. We have waiting room assessors as well. There's no stone being left unturned. We have additional hours in emergency rooms where the volume is high. We have float MD, which allows an additional physician in the emergency department. We are working very, very hard. It's a very specialized skill set. We understand that the communities have needs, and we'll continue to invest in Nova Scotia.